It can be argued that no one is feeling the brunt of COVID-19 more than residents in long-term care who have lived through months of isolation and fear. 88-year-old Devorah Greenspan is one of them. We talked to her back in June and checked in with her again, now to see how she's doing during this second wave.
I'm very afraid. I am afraid. I'm afraid of getting sick at my age.
Yeah, that is her. We first met Devorah Greenspan after she endured more than 3 months of crushing loneliness in her small room in her Toronto long-term care home. She had a brief reprieve in the summer when she could finally see family for socially distant visits. But that ended when COVID cases went back up.
Now that the numbers have increased, all visitation is finished, and I cannot go out and spend time with my family. So my life has totally changed again. There's no social interaction except with the staff.
12 residents, many of them Devorah's friends, died of COVID during the first wave. But it's not just the pandemic that scares her.
If I have to be cohorted again, I don't know how I'll handle that. I don't even know if I can handle that.
The loneliness?
The loneliness, yeah. The loneliness, the lack of, as I said, lack of communication, the feeling of depression and being afraid.
Yeah.
And wondering about what's happening to everybody else in the building.
The biggest concern for advocates as the second wave continues is the shortage of staffing, which has been a problem in long-term care for years. Underpaid and overworked PSWs couldn't keep up with the strain COVID added to the burdened system.
Are we better prepared? We're forewarned, but we're not ready.
Laura Tamblin-Watts is an advocate for seniors.
This government spent, I would say, August and September reflecting, but not acting. And other governments, for instance, in BC and Quebec, moved more quickly.
Quebec launched a plan to hire and train 10,000 new long-term care workers in June. But Ontario only announced a new hiring initiative for PSWs 3 weeks ago. CityNews asked the Ministry of Health how many have been hired in the months since the first wave abated, but has not received a response.
I think Doug Ford, I love the seniors, how he comes out and says that. I love the seniors. Well, put your money where your love is. He's going to change the system. Nothing has been done. There's been no changes.
A solution advocated by the provincial association representing residents is to create a new layer of staff that would provide more social support for residents and take some pressure off PSWs.
When you don't have enough team members on board, things will get missed.
Devorah knows it could be a long winter ahead, but she's going to try and keep the fear and loneliness at bay.
I'm going to be honest with you, it's very hard to be up. When I think about my kids and I look at the pictures on my wall and I speak to my grandkids who call me and say, "Grandma, are you okay?" That keeps me going. It gives me the courage to keep going.
As of today, 86 long-term care homes are in outbreak. That's a 95% increase since September 28th, when Premier Doug Ford declared the second wave had arrived in Ontario. 216 residents and 260 staff are currently positive. Close to 2,000 residents have died.